I'm going to talk about Ashville Surgery and how it's done in the National GP Patient Survey 2023. The survey is run by Ipsos for NHS England, and it was sent to over 2 million people across the UK. Of those, 553 were sent to Ashville patients, 135 sent back, 25 completion rate, which is not particularly high. Here's the sort of summary you can get from the website. On the left-hand side, it's got the practice details and the overall experience, which was good, and in fact is outperforming the national average of 71% by being 85%. Then on the right, you've got accessing the practice, things like helpfulness of receptionists, how easy it is to get through on the phone. And overall, if you look at those in any detail, you'll find that Ashville is outperforming both nationally and regionally. Here's more about the appointment experience. Again, all generally in the 80s and 90s, overperforming compared with national comparisons as well. So I'm quite pleased about that, I think. And here's a sort of summary of it as well, some of the things that it came up with, where the patient experience is highest compared with the regional result. That's the Greater Manchester experience, and 80% of respondents describe their experience of making appointments as good. They're happy with the general practice appointment times available, and they were offered a choice of when they wanted to make an appointment. Where it's lowest compared with the ICS results, that's the regional results, 70% were given their time for the last general practice appointment, and this is one that's lower than regional and national results. And I think the practice are looking into this. We're not sure exactly why that happened. Here it's talking about the local GP services, and only 65% found it easy to get through to the GP practice by phone. Well, still outperforms nationally, but still isn't brilliant, is it? Finding the receptionist helpful, I think, is really important and really good, and it's very high. And generally accepted, and they usually get to speak with their preferred GP. Well, that is pretty rare actually nowadays, isn't it? 42% is low, but it's high compared with national and regional results. Still, it's one of the problems, but I think most people, I've certainly got accept that I get whoever who's available at the time when I want to see them, rather than, if you like, my personal GP. Making an appointment, again, very satisfied with those. You can always pause to have a look in more detail at those. And overall, 70% said they'd had enough support from local services and or organisations in the last 12 months to help manage their long-term conditions. Again, higher than average. And 85% described their overall experience of the GP practice as good, which I think is really one of the most important ones. It's saying that people on the whole who are in the Ashville practice are quite pleased with the service they give. And you can look at with other local GPs to see how they go, and by and large I think they certainly do better than most. These are sort of the appointment times given. They were good at getting enough time during the actual appointment. They were spoken to and listened to well, and they were good at treating them with care and concern. Overall, again, pretty good going. In relation to mental health, and they were quite pleased about that by and large, 89%. They had trust in the 98% had confidence and trust in the healthcare professional they saw. I think that's remarkably high, and very, very good that that is the case. And they felt their needs were met, again, by and large. And that's that.